Hey everyone, welcome back to the channel. So today I want to talk about another portion of the series that I have been doing on symptoms at end of life. And this is particularly for these patients that are maybe right before they get onto hospice, or maybe they're almost ready for hospice, just not quite, and or just starting out on hospice, and or if they are on hospice or almost there, they're still kind of mobile. So I want to talk about that today, especially in reference to skin. So let's get into it. My name is Abigail, here to normalize these conversations and education about death and dying so we die better at end of life and then live a good one till we get there. Let's get into it today. These issues with skin, generally, in the medical field, when someone's in bed and someone spends a lot of time in bed as a patient, caregivers, medical caregivers are usually pretty good about looking at skin, turning them frequently, being really aware of all these forces, shearing and all that kind of stuff, pressure that can have risk to skin integrity. Why do I even bring this up at end of life? I mean, does it really matter? Yeah, because what happens is, while you're not going to try to maybe necessarily fix the wounds or try to make them get better, you really want to prevent them from getting worse. And you really want to hopefully prevent them from developing at all if you can. But the issue is when we're dealing with end of life, and someone who's particularly on hospice or qualifying for hospice and they're getting close to hospice, their defenses, all of their organ systems are not working optimally. So the whole point of this message is to really stress that point. Because even if your loved ones, say they may be getting in and out of bed regularly and moving to the chair and having their coffee during the day, watching their TV show, maybe going outside a little bit, whatever it is, it's even in these patients that look more mobile than the regular person in hospice that's in bed a lot of times. And again, hospice can look different for everybody. You still have to be concerned about their skin integrity. And I remember I went out with one of my staff nurses to see a patient who was very, very thin, and she had just gone on hospice, and amazing little lady. She was just amazing. But she was very mobile. She was very, very mobile. She could do a lot of things on her own still. She had a diagnosis that qualified for her hospice, obviously. And I remember telling her, I said, I know she's not moving around. I know she's moving around a lot, but I need you to watch her coccyx, which is kind of this bone that's kind of like at the crack of your butt crack. I said, I need you to watch her butt, watch her coccyx, because that's going to break down really quickly for her, even though she's moving a lot. And it mainly was because she was so thin and likely, I think with her labs and everything, really well malnourished, which kind of makes sense, even though these people who are really, really thin at end of life, they have certain adaptations. So their body kind of adapts to that depending on the circumstances. And I remember getting a message. I think she left the voicemail because I was on the other line the following week. And she said, oh my gosh, you were right. And it's not because I'm especially smart. It has to all do with experience, trust me. And it was only because of experience that I was like, you got to watch that. And she said, you won't believe it. She started breaking down on her butt, on her coccyx. And so, of course, we instituted things to make that better. But again, yes, you pay attention to people who are in bed, and you got to pay attention to the elbows, the knees, all the bony prominence areas, the hips, things where the bones are, the shoulder blades, the head. You won't believe how you have to look at the back of the head and actually examine that. The ears, if they're on oxygen, you got to look at behind the ears. Look at the below the heels and everything. You've got to look at that, and hopefully, hospice will tell you more about that. But yes, look at all those areas. And ideally, a person needs to be repositioned every couple hours, especially if they're in bed the whole time. But if someone is still a little bit mobile and they're coming in and out of bed and they're shifting around, that's really good, but you still have to pay attention to that. And mostly the big area is usually the butt, usually that butt crack, usually that coccyx area. Because yes, maybe a person's going to die in a month, but those wounds not only can be painful, they require additional care, additional dressing changes. If, someone, loses continence and they pee without control, or they have a fecal, or they have a bowel movement, and diarrhea, whatever, it gets into that wound, it can become infected. And then you're dealing with trying to treat and manage an infected wound, which can cause other multiple problems, can progress very quickly, can go to the bone, more pain, necrosis or dying tissue. The smell can really impact dignity, in addition to all the other things that go with it. And then not only to mention, it's like when you're trying to die in bed and then you have to be turned multiple times over and over just to take care of that wound and feel the peeling of the dressing and having a new dressing on. And then if you go to the bathroom without knowing it, having to change that dressing again, it's just unnecessary stuff at end of life when you need to be focusing on dying, or your loved one needs to be focusing on dying comfortably. So skin still really plays a big part in this whole thing. I focused on the pressure areas in particular, and how we really want to focus on moving yourself or moving your loved one every 2 hours. Ideally, of course, at night it's a little different, especially that can be a little bit tougher, but always cover this with your practitioners so that you know that what's specifically appropriate for you and for your loved one. Let me know if you have questions. Let's continue to normalize these conversations and education about death and dying so we get better end of life. I really hope you have a good day today. Take care of yourself. Bye-bye.